Welcome to Instruction Discussion, our weekly look at the latest topics and trends in education affecting schools here on Long Island and schools around the world. Whether you're a teacher, parent, or student, listen for tips and strategies to help you navigate the educational landscape. There's a bell. It's time to start today's Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC.
Hello, I'm Kevin Boston Hill, and welcome to Instruction Discussion, where each week we will examine a recent trend or development in education and its impact on Long Island. COVID has been blamed for a lot of things, especially in terms of child academic development or deficiencies. One aspect of child development, or even adult development for that matter, that cannot be blamed on COVID is obesity. Even before the pandemic that sent everyone indoors and away from the gyms, there was a growing concern of people in this country becoming severely overweight. Medical experts have constantly shown us the detrimental impact of being overweight: diabetes, heart problems, etc. Currently, 4 in 10 U.S. adults are classified as obese, and 23 states have adult obesity rates at or above 35%. Just a decade ago, no state had obesity rates above 35%. Additionally, obesity rates among youth are rising, with nearly 20% of youth being classified as obese. Aside from the health concerns, childhood obesity also impacts academics, from lost instruction due to absence from school, or lack of concentration due to poor nutrition. So what can be done about it? Visiting the classroom today is Dr. Nadine Gracia, President of Trust for America's Health, to discuss obesity trends, the relationship between obesity and food insecurity, and some ways we can reverse these trends. Dr. Gracia, welcome to Instruction Discussion on 90.3 WHPC.
Thank you so much. It's a pleasure to be with you.
And again, thank you for doing this. I know this is, again, it's a very important topic as we are, new school year is beginning, and we're in a very tenuous cycle as far as food in this country. So I know it's something that we really do need to discuss. So again, thank you for joining us this afternoon. So talk to us a little bit about the recent report on obesity in this country and some of the implications.
Yes, so our State of Obesity report shows that the rising rates of obesity continue to be really an important and a serious public health issue. As you noted, we are seeing rising rates of obesity that is not just in the last couple of years. This has been happening over decades. If you look at the past 20 years, for example, adult obesity rates increased by 37%. Childhood obesity rates increased by 42%. And obesity really is a complex health issue. There are many factors that can contribute to obesity. And when you see this type of population-wide, really all population groups are seeing these rises in obesity, it really means that we have a population public health issue, and we really need systems and policies and programs that will help to address the obesity crisis. As you noted, 23 states now have an adult obesity rate at or above 35%. And a decade ago, there was no state that had an adult obesity rate at that percentage.
So, I know you said that there are a lot of factors that may go into figuring out obesity, but how do we get there? Because you think that one aspect would be if people are overweight or obese, then the economy must be good because they're eating well or they're eating enough and so forth. So we know that's not necessarily the case as far as the economy goes. And we also noticed that there are a larger number of obese children in communities of color. And we know that they're not doing all that well academically or economically. So it seems like there's a reverse correlation there as far as obesity and economics. So what is that relationship?
Yeah, well, I think something that you raised too about thinking about this in terms of people's size must mean that we're doing well economically. But when we talk about obesity, we're not referring to someone's size or how they look in an image. It's really saying that we're looking at their level of body fat and that body fat distribution, and is that higher than what's considered a healthy weight? Because if it's not a healthy weight, then it can put someone at risk not only for obesity of itself, that it's a condition itself, but also for other medical conditions like type 2 diabetes or heart disease, stroke, certain types of cancer. We see even in kids increasing the risk of high blood pressure, as an example. And so when we talk about multiple factors that contribute to obesity, one, it's not determined by or just influenced by individual behavior. In fact, there are multiple factors like socioeconomic factors, structural factors that contribute to obesity, your environment, the foods that you have available to you. Are they actually healthy and nutritious foods? Or do you have the ability to actually engage in physical activity in your neighborhood? All of these factors contribute. And so when we talk about the economics of this, what we know actually is that often the foods that people who, if they have low wages, don't make as much money, families that are struggling to make ends meet, often they struggle to actually purchase those healthy, nutritious foods because they often are higher cost, and they often are buying foods that may be higher in calories, so it fills you up, but those foods are actually less nutritious and can put you at greater risk of obesity. So when you think about what are we seeing as changes, a major change is in the U.S. diet across the population, and in particular, for example, ultra processed foods, those packaged foods that are not naturally processed foods, not the fruits and vegetables, but those packaged foods that can be high in sugar content, added sugars, high in sodium and other nutrients that aren't healthy nutrients. And so really that's why we talk about the need to ensure that we have healthy foods be available for everyone so that they can have and access a healthy and thriving life.
Now, I know when it comes to selecting the proper foods, I know when I go grocery shopping, I go into the supermarket. My rule of thumb is I do my shopping on the outer areas, like the outer fringes of all the aisles, because that's usually where the fresh produce is. That's usually where all of maybe the meats and fish and things are available. Once you come inside the aisles, that's when you see all the processed foods. So how do we ensure that people are thinking in those terms? That when you go shopping, you kind of go around the outer fringes of the aisles as opposed to heading straight for the middle aisles?
Well, you point out something that's really important, which when we talk about just even the foods and our food availability, it's also thinking about how businesses in the food industry can also be thinking about that marketing, right? And how food is distributed, how we look at when you go into the grocery store, where foods are placed. An important thing is also empowering consumers to know how to identify what is a healthy food. Fresh fruits and vegetables, people have that understanding that those are healthy foods. There's actually movement now, for example, by the Food and Drug Administration to try to improve that access to information for consumers so that they know whether or not what they're purchasing is really a healthy food. So, for example, they're working on front of package labeling, where on that front of the package, you'll be able to see, is it high in added sugar content? Is it high in sodium or salt or other unhealthy nutrients? So that consumers, moms and dads, other people can make decisions about, is this the right food that I should be purchasing for myself or my family? We know that people are pressed for time and they may be on limited budgets. And so trying to make those types of changes to how food is actually packaged and then purchased, it actually makes a difference for communities. We're also seeing efforts, for example, to reduce the sodium, the amount of salt in foods. We can tell people you need to lower your sodium, your salt intake, but actually it's not so much what's happening at home by adding salt to your foods. It's actually what's in the food supply itself. So again, the Food and Drug Administration, for example, a few years ago started what's called these voluntary sodium reduction goals to help the food industry start to phase down and lower the salt level in those packaged foods as well as in restaurants, so that our food is actually healthier, and it doesn't require having to just be able to identify which foods there are, but actually that our food supply generally is healthier.
Now, and I don't want to go down this rabbit hole too far, but salt and sodium is really used as a preservative as much as a flavor enhancer when it comes to how things are packaged. So if companies are going to start reducing the amount of sodium as a preservative, what are they going to turn to?
Yeah, so actually that process has already started, where now this is voluntary of what the food industry has been doing. And just a few weeks ago, Food and Drug Administration actually put out a report showing that there's been progress. And the reason that's being phased is, one, because they want to make sure that we as consumers can actually tolerate and continue to eat those foods. Because if you make these drastic changes, then people might not want to try those types of foods and really say that the food supply has actually changed quite drastically. But even those small changes can have a significant amount of public health benefit. So there's guidance that the FDA is providing to industry on how to make those reductions. And we've already seen that actually in a majority of the food categories, they actually attain the first phase targets. And now the FDA is proposing a second phase with regards to continuing to further reduce those. We actually have seen this type of work done in other countries, and as well as front of package labeling, and seeing the public health benefits that exist. But in addition to that, we also want to assure that even the marketing of foods, we understand the marketing as well, because what we see is that there's actual disproportionate marketing of some of these unhealthy foods, especially to children of color. And we've seen that, for example, sugary drinks or candies and other types of foods. And so it's important, like as a step that can also be taken, is really where policymakers could actually end those types of business tax deductions and loopholes around unhealthy marketing of foods, because that influences too what you eat. We have to expose kids and young people to fresh, healthy foods, and that can actually help with regards to changing our diets. But we also have to ensure that those foods are actually accessible and they're affordable. That's also a challenge as well that we see.
No, I think you're absolutely right when it comes to the affordability of foods, as well as the availability, and not just the availability of the fruits and vegetables themselves, but also enticing fruits and vegetables. Because it's one thing if you walk into your local bodega and you see a bunch of brown bananas, are you really going to be enticed to pick that up? Or are you just going to then turn to the pack of potato chips that are on the shelf as well? And which one are you going to go for? You're not going to turn to the brown fruits or the mushy vegetables, because it just doesn't look good. So again, the companies, the businesses may say, we're putting it out there, making it available, but what quality are you making available?
Yeah, that's absolutely right. And when you make those kinds of enhancements, like for example, we saw with the WIC program, which is for women, infants, and children pregnant moms, breastfeeding moms who have low incomes can qualify for this type of program. And it provides that type of nutrition assistance for the mom, for infants and young children. There were changes made to the WIC food packages to better align with nutritional guidelines. Those changes actually helped to see improvements in terms of health outcomes for children, where we actually saw reductions in obesity among children who are participating in the program. So when families are given the opportunity and when they're given the benefits and the resources to be able to buy those healthy and nutritious foods, they make the right choice to do it. It's just there are a lot of barriers that exist for far too many households and families when it comes to being able to access healthy foods if they're in their community and if they're affordable. And that's also, do they even have a living wage to be able to afford those types of healthy and nutritious foods? There are a lot of policies that we know work. We just have to assure that those policies are implemented and that every community has access to those resources.
You are listening to Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC. My name is Kevin Boston Hill, and our guest today is Dr. Nadine Gracia, President of Trust for America's Health. Now, I mentioned earlier that some of the impacts of obesity on children are academic. And so what is that correlation between obesity and academics and also food insecurity in academics? Because I know not having the proper nutrition can lead to lack of concentration in class and some other things. So talk to us a little bit about those correlations.
Yes, when you're food insecure, it means that your household basically doesn't have enough food to lead an active and healthy life. And when you think about that, that's a family that is really struggling to make ends meet. And when you have to make those decisions around paying the bills, paying the rent, buying foods, what's easily convenient, it's available and often less expensive are those foods that are less nutritious and that may be higher in calories. And so if that's the diet that you have, that increases risk for obesity. And so there's that relationship between food insecurity and obesity. And a significant driver of obesity is actually poverty. When you have lower incomes, then we see in many studies that communities that have lower incomes, they are less able to purchase higher quality, higher nutrition, not nutritious foods. When it comes to the impacts we see then in school, there can be multiple impacts. If a child doesn't have access, for example, to nutritious meals in school, that can, yes, absolutely. You don't want to have a hungry child, that is suffering from hunger, that then would affect their concentration and their academic performance, which is why it's so important, for example, to have access to school meal programs like the school breakfast program, school lunch programs. There's now some states that actually have what's called healthy school meals for all, which means every student has access to healthy meals regardless of their income. There was actually a policy for that during the pandemic where they waived the policy and allowed all students to have access to those school meals. But now we're seeing since the pandemic, some of that policy has ended. And so now we're returning to a state where kids that may not be able to pay for those meals, we can think about if they're not able to pay for that, or if they can only afford other types of snacks, then that's not going to be a nutritious meal for a child to really do well, thrive in school. There's also a concern too, if you have to pay for school lunches, that there's a concern of if you're not able to do so, or if you're in certain programs, right, like a school lunch program, this feeling of being shamed, right? Like lunch shaming, because you actually don't have access to it. And you worry about like children and families where there may be increased absenteeism because either they, for example, do suffer from food insecurity or have other issues that are happening. And so we want to remove those types of barriers and barriers for schools, because some of the administration of those types of programs can really take a lot of time to implement. So part of the effort is also how do we make those types of programs more readily accessible in school districts and schools across the country.
Now, I think one part of the obesity factor that we haven't touched on just yet is the lack of mobility. I think you mentioned earlier as far as having access to being able to freely exercise and be active and so forth. And of course, we know that once mobile devices came out, kids are doing that all the time. And because of COVID, they were stuck inside and nobody was really going outside to play or anything. We know that students aren't going to give up their devices. They're not going to put their devices down to go outside and play until the streetlights come on like we used to do. But how can we take if you can't beat them, join them mentality and turn those devices in our favor?
Well, I think you note an important aspect, which is, having access to physical activity and regular physical activity, because that's also important in addition to healthy nutrition. I think that here is where we actually can see increased investment, for example, into effective, proven obesity prevention programs that address both nutrition and physical activity. The challenge is that the level of funding is insufficient to actually reach all communities and states. I'll give you as an example. the state physical activity and nutrition program, which helps with regards to increasing access to physical activity, increasing access to healthy nutrition, doing education around healthy nutrition. The level of federal funding is only sufficient to fund 17 states in the country. And yet we know that obesity really exists across the nation. And so that's where our lawmakers, policymakers at all levels, at the federal, state, and local levels, should be making those decisions to fund those types of obesity prevention programs, where those programs can adapt and identify, well, if kids are on devices, how do we think about how to reach our kids effectively to be able to support them with these types of proven programs that will help to increase their physical activity? There are other strategies as well, such as how we think about the built design of our neighborhoods and communities. Our communities walkable, with biking paths, with sidewalks and community parks and playgrounds. There are far too many communities that don't even have access to those types of resources to assure that you can have what we call that active movement, right? So even if it's not a physical education class, can kids walk to school? Can they bike to school? We've seen actually when communities, neighborhoods, and cities and towns actually invest in that type of routing, where you actually have these what we call safe routes to schools or complete streets, where you're able to have that type of active transportation, we see more physical activity among students. So those types of structures and systems, when we can actually make those healthy choices the easy choice, that's where we can really lead to greater change across a community and neighborhood.
So how can families really galvanize their communities to make these changes, to help really spur some type of changes going on? I mean, is it as simple as contacting their local representative, or what can they really do to start this process going?
Absolutely. Always engaging with, your local policy makers. So your local representatives, working within your school districts and your school board meetings to understand, what are the types of programs and resources that exist within your schools and taking an active part there. And it's important to understand that policymakers really have an important role to play here, because it's not that we don't know what works, is that we need to actually fund and invest in what we know actually works. And so whether that's increasing access to healthy school meals for kids, whether that's, we've now seen that there's more movement, for example, around school meal standards to better align those school meal standards with the dietary guidelines. There's actually the latest change is now there's going to be an added sugar limit to those school meals. Those are the types of things that when you see that change, it can be changed for all kids and all youth. We also need to assure that people have access to healthcare and assuring that they're being able to go and see their primary care provider and getting routine care and getting access to the type of screening as well as services that they may need. So while there's a lot that we know that families may be able to do, really when we think about just how significant, how widespread of an issue obesity is, we also need these broader policy and systems changes as well to assure that families have the information that they need to make informed choices, but also that we're ensuring that our food environment, that the communities that we live in actually promote health and well-being.
So I think we may have touched on this a little bit earlier, but how does obesity impact those in Black and Latino communities differently than in other communities? And how can that particular trend and issue be addressed?
Well, I will say that what we know is that obesity is impacting the population across the United States. But what we know is that it's not impacting all populations equally. And we do see higher rates of obesity among certain communities like Black and Latino populations, as you noted. We also see higher rates of obesity in communities that have low incomes. We also see higher rates of obesity in rural areas as well. And the important thing to understand is that really what is leading to a lot of these types of disparities are really the socioeconomic, the health disparities, longstanding health disparities, and socioeconomic inequities that have existed in these communities. And that really stems from what we've seen when you think about the historical redlining that happened in communities and leading to disinvestment in communities of color. That disinvestment meant that there were less access, and studies have shown when you look at communities where you have a larger proportion of Black residents, they're less likely to have grocery stores, or we have communities where they have lower incomes, similarly, less likely to have access to grocery stores. You see that the neighborhoods may not be designed with parks and playgrounds and biking paths and walking paths that really helps to promote physical activity. And so it's not the individual community member themselves that has done something to increase their risk for obesity, but it's actually because we've seen this kind of structural and economic disadvantage that exists in these communities. And then what you see is, for example, higher rates of fast food restaurants or other types of food retailers that the source of those foods are not as healthy and nutritious. And so that's why it's so important that when we think about these types of policy and systems changes, that we understand that the disparities exist and that those disparities have to be addressed to ensure that everyone has the opportunity to be as healthy as possible.
Now, I think a particular solution that might be the answer to a lot of these issues, or one answer to a lot of these issues, would be developing a community garden. So now what you're doing is not only are you bringing in or making accessibility to fresh fruits and vegetables, but you're also probably providing a source of employment for some people in the neighborhood. And you're also creating not an outdoor space where people actually have to walk to or otherwise, and they're working outdoors. So they are getting some sort of physical activity now. So you're killing proverbially multiple birds with the same stone if you're able to do something like that. So why don't we see more of these community gardens popping up around?
Yeah, you're describing an important thing, which is that actually meeting people where they are and bringing those resources into the community where people actually frequent those kinds of places, like community gardens or having community gardens. There's some initiatives like a fresh food financing initiative that has existed to actually incentivize having fresh fruits and vegetables more in the corner stores and other types of stores, because we know also even the transportation sometimes to get to the places that sell those healthy foods might be a barrier and a challenge. So that's a type of investment that can be made and should be made. And we see that in some communities, certainly with regards to community gardens, and also that the community gardens are not only a place to access those foods, but to learn about those foods and learn and expose kids to the foods so that they have an understanding of what health and nutrition mean. So those are the types of investments that we should be seeing increase in communities, especially where there might be barriers to bringing in or having other types of access to resources for those communities, is also saying there's assets and, like you just said, opportunities to create more jobs in communities. And in creating those jobs, also assuring, do folks have a living wage then to be able to afford those types of healthy and nutritious foods as well?
Well, we would certainly like to thank our guest today, Dr. Nadine Gracia, President of Trust for America's Health, for coming on to our show today.
Thank you so much, Kevin. It's been a pleasure to be with you.
Once again, my name is Kevin Boston Hill, and thank you all for listening to Instruction Discussion, right here on the voice of Nassau Community College, 90.3 WHPC.